Well, Trish, my name is Lionel Chang. I'm a qualified plastic surgeon and a member of the Australian Society of Plastic Surgeons. I'm here to talk to you about Asian eyelid surgery, which is the most popular operation in Asia because the way most Asians' eye looks, and they love to have this procedure because it does change their face significantly and make them more attractive. Well, I guess people view Asian eyelids as a little bit narrow or slit-like, and the reason of why it's looked like that is because when the eye is open, the skin drapes down and covers the top of the eye to make it look narrower. By raising that, you're not only adding feature to the upper eyelid, but it makes the eye look bigger, and because of that, it looks more attractive, and that's why most Asian young women, anyway, wants to have that kind of configuration. Yes, the difference between Asian and Caucasian is not just a single factor. It's not just the eyelid. People call the Asian the slit eye, but in fact, there's a variety of things like hair color, skin color, the color of the eye. And obviously bone feature is a big thing because it influences the way the skin folds and the configuration and all that sort of thing. And if you look at the difference is that in Caucasian, they're very prominent in the brow region, the supraorbital ridge, and the nose is much bigger or forward projecting, especially in the bridge area of the nose. And also the Caucasian tend to have deep setting eyes. That means their socket is located a little bit back in the head and their eye is located backwards. And because of that, when they open their eyelid, the eyelid sort of slides up on top of the eyeball under the supraorbital shelf. Whereas in the Asian, it's the reverse. The face tends to be relatively flat and the nose, especially the bridge area, is a little bit retruded. And the orbit is a little bit shallower and more forward placed, and because the eyeball is pushed forward by that, it looks a little bit popped eye, so to speak. And because of that, the eyelid tend to go up and down rather than slide under the supraorbital shelf. So these are all the difference in feature that distinguish the two groups of people. Well, like everything else, I mean, like handiwork or painting, a good work, an artist can do a better job than somebody who sort of has no idea of the concept of beauty. I think the concept of beauty is important, and not everybody has a good grasp of that. Secondly is the skill of the surgeon. It's a very delicate operation, and you're very close to the eye, so you have to be very skillful. And I think these two factors are very important. One is the artistic flair, and the other is the surgical skill. Mainly at Burwood in Sydney, that's where my main practice is located, and the surgeries also performed there under local anesthesia. I prefer to do them under local anesthesia than general anesthesia for two very obvious reasons. One is cost, because if you need to go to hospital and do under general anesthesia, you got to pay the hospital, you got to pay the anesthetist. That more than doubles the cost. Secondly is that it's safer to do it under local anesthetic because you're fully awake and the surgeon has to be more careful, and therefore that's good for the patient. Thank you, Trish.